Hi there, Alicia here, and welcome to tutorial 20, this is. And in this tutorial, we are going to look at a strange pair, and it is the pair must and have to. Now, we learned in quick tutorial 19 that if we're talking about the present and the future, we can use the modal verb, that is the helping verb must, to show obligation, to show you have no choice, at least not without bad results. But that if you are talking about obligation in the past, then we have to use the verb phrase have to, which has the same meaning. And we looked at how to talk about positive sentences with must and have to. And we got a glimpse of putting together negative sentences with must and have to. And I told you that in this tutorial, I'm going to look a little bit at why there is something a little bit odd with have to in this tutorial. And that is what I'm going to do. So I'm going to start with a little challenge for you, and it is this. Which of these four is the odd man out? That is, which one does not belong and why? So we have must, we have to, we have must not, and we have do not have to or don't have to. Which one is the odd man out? Well, hopefully you guessed do not have to or don't have to. So the question is why? And here's why. With must, we said, as before, there's an obligation. You have no other choice, at least not without a negative outcome. With must not, there's also kind of obligation. There also is no choice because the alternative simply is not allowed. Have to also, there is obligation there. You have to do something. There's no other choice, at least not without a bad result. But here's the thing, do not have to or don't have to actually means that you do have a choice. Take a minute, let that sink in. You can watch this part of this tutorial a few more times to kind of understand exactly what is going on here, what I'm saying, that with do not have to, you actually do have a choice. So let's look at some examples to demonstrate. Scenario one, you work in the office booking appointments for patients, and you are booking appointments for an eye specialist or an ophthalmologist. That's quite a mouthful, so let me say it again. Ophthalmologist. A patient, Mario, calls. The important points about her case, problem, cloudy vision, wants to see the ophthalmologist. Her obligation, first, get referral letter from GP. She has no choice because this is always the first step before seeing a specialist. So what do you say? You say, Ms. Yo, you first must get a referral letter from your GP, or you first have to get a referral letter from your GP. Both of these mean the same thing. But we go on now to scenario two. However, there are two ophthalmologists she can see. There's Dr. Elder, an older consultant, and Dr. Young, a younger consultant. Maria Yo prefers to see the older consultant. She has a choice. She can see either one. You say You don't have to see Dr. Young. You can see Dr. Elder. By saying you don't have to, you're telling her that, in fact, she has a choice. So here's a question for you. You are talking to the son of Sally Nice, who left hospital a few days ago. The important points in her notes: motor vehicle accident, hip and knee surgery. But Ms. Nice does not like to get out of bed. To improve, obligation, walk around, continue physiotherapy. About physiotherapy, she has a choice: continue at hospital or continue in her community. So what do you say to the patient's son about her improvement and about physiotherapy? You should have answered, or something like this: to improve, Ms. Nice must or has to walk around and continue physiotherapy. She does not have to continue at the hospital. She can continue physiotherapy in her community. So if you said anything like this, obligation, must, with walking around and physiotherapy, but showed that she has a choice when it comes to physiotherapy by saying does not have to, you would be correct. So again, to improve, Ms. Nice must walk around and continue physiotherapy, but she does not have to continue at the hospital. She can continue physiotherapy in her community. That's it for now. Bye-bye.